Okay, hello everyone. Before we get officially started, I want to do a quick sound check. So can everyone hear me and see my slide on the screens? Put a yes or a no in the chat box if you can hear me and see my slide on the screen. Okay, great. Well, welcome to today's webinar titled Health Equity in Tobacco Control in our Healthy POS Webinar Series here at CounterTools. My name is Jackie Boards and I will be your moderator for today. Our speaker for today is Michael Scott from the National African American Tobacco Prevention Network, or NAATPN for short. I want to start by saying thank you all for being on this webinar today, and I hope you take away some helpful information as it relates to the effects of tobacco use and the predatory tactics of the tobacco industry on minorities and disadvantaged populations, along with learn what you can do and what organizations like NAATPN are doing to aid in the fight and help strengthen communities. I want to first do an introduction to us here at CounterTools and then provide some background on our speaker. First, our mission is to empower communities to become healthier places, starting with the retail environment or the point of sale. We provide consulting, in-person and web-based trainings, storytelling materials like infographics, and we have a suite of tech tools that help in documenting and tracking what's happening directly in communities, such as our Store Audit Center and Store Mapper. And we support efforts across the country as it relates to advocacy and research. You can find our website below, countertools.org. And also, please make sure to visit countertobacco.org if you haven't already, which is our comprehensive site for all things point of sale. Here you will find the latest and greatest in research, a photo gallery, policy solutions, youth engagement activities, and much more. And here's a snapshot of the states we currently work with or have worked with in the past. In addition, we have many partners that we continue to support and join with, including organizations like the Campaign for Tobacco-Free Kids and the Truth Initiative. Now for our speaker. Michael Scott is the Program Manager at NAATPN, Inc. He has been involved in tobacco use prevention and public health for the past 16 years. Prior to his position at NAATPN, he served as a health education specialist at both the Durham County Department of Public Health and Duke University Medical Center. Mr. Scott holds a BS degree in health education from North Carolina Central University and is a certified health education specialist. He is the proud father of 2 sons and 1 daughter. Okay. Now that we've introduced us here at CounterTools and I've introduced the speaker, I want to let you know that you can drop any questions you have throughout the webinar in the chat or Q&A boxes. Either one of those will work. There will be time at the end for questions, and we also will try to take questions throughout the webinar. So if you have any questions, or even if you're having any issues, technical issues, please drop those in the chat or Q&A boxes, and we will be sure to take care of those. Now I'm going to hand it over to Michael.
All right. Thank you, Jackie. Do I have control yet?
Yes.
All right. There we go. All right. Thank you again, Jackie, and good morning, everyone. And thank you for taking time out of your day to attend this webinar. I hope it is informative and useful. Again, my name is Michael Scott. I am the Program Manager for NAATPN, Inc., the National African American Tobacco Prevention Network, where our mission is to facilitate the development and implementation of comprehensive and community-competent public health programs to benefit communities and people of African descent. So, we are actually one of 8 nationally funded networks funded by the CDC to address tobacco and cancer among priority populations that are disproportionately impacted by tobacco use. So the 8 networks include us as the African American Network, And the 7 other networks address populations including the geographically defined, LGBTQ populations, those suffering from mental or substance abuse disorders, American Indians and Alaskan Natives, Asian Americans, Native Hawaiian Pacific Islanders, Hispanic populations, and those in low socioeconomic circumstances. So as you can see, there are quite a number of populations served by these national networks, and they are all characterized as priority populations when it comes to being disproportionately affected by tobacco use. So as we go through the presentation, a lot of my information will be African American centered, because that's where we focus our work. However, these other 7 organizations that are listed pretty much do the same thing we do with those specific populations. So as we go through the presentation, and many of the examples that I'm giving are coming from the African American experience and how my organization works across the country. These other organizations do the same thing with those specific populations. So although some of you may not be working with African Americans, but you may be working with LGBTQ populations or Hispanic populations, a lot of the work that I'm giving examples of can be done with the help of these other organizations as well. And I do need to mention that all of us, all 8 of our networks are available to provide technical assistance to folks across the country. So if there's a specific population that you're working with in regards to tobacco use prevention, please feel free to reach out to me, and I can make the connection to these other organizations, or just reach out directly to those organizations. So the outcomes for today's presentation, I want to give you a historical context of African Americans and tobacco use, show you the impact of menthol specifically on African American communities, and some of the latest efforts to combat the tobacco industry. And then talk a little bit about how to engage African American communities, or whatever specific community you're working with, in tobacco control activities. So just briefly, we all know that the smoking rates in the US have been declining for some time. So right now, overall, we're looking at about 15, 16% of the American population smoking. But if we look at some of these priority populations, people below poverty level, uninsured, people that identify as multiracial, people who have a low education level, we'll see that those rates are much higher. So looking at the health of the United States in general, I'm going to show you guys a few maps. So here we have the stroke. This part of that map stroke death rates in the country. So just keep an eye on that dark patch, because all these maps are going to have similar appearances. But here we have heart disease. Again, that same patch of the map, we're seeing higher levels of heart disease in that specific little swath of states on the east coast of the United States, east coast and southern states. And here are, again, cancer clusters. Again, same thing. We see that same dark patch. Well, here it's red, but it's the same geographic location for the highest rates of cancer, heart disease, and stroke. Now, if we lay that map down and look at the African American population in the United States, what do we see? Again, that blue swath of states, very similar to the other dark areas on the maps. So we see that where African Americans are living is where a lot of these conditions are more present in the United States. So, why is that? So currently, African Americans make up about 13% of the entire population of the United States. 20% of which live in those southeastern states. And among all racial and ethnic groups, African Americans bear the greatest burden from tobacco-related diseases. So when we're talking about lung cancers or any of the numerous other cancers that are related to tobacco use, African Americans are suffering the worst consequences from that use. So we'll go back a few hundred years to figure out, well, how did we get here? You know, what's the deal with tobacco? Why is it still, why is it still around? How did it get here? So we'll go back to junior high history class and talk about John Rolfe. If folks remember that name from way back in the day, he is credited with bringing the first batch of slaves to America, to Jamestown. So most of the time when we think of slavery and slaves and farms, we think of cotton. However, the initial purpose of bringing slaves to America was for the purpose of farming tobacco, bringing that first cash crop tobacco to the United States. And this is just a picture of a slave ship, some slaves on their way to the Americas. So after years of slavery, slaves were finally freed. However, what were they to do? Many of them stayed in the South, worked the farms, but the tobacco industry was actually the first major industry to provide freed slaves, African Americans, with jobs, with careers where they were able to support their family. They were able to send their kids to school. They were able to make a life. And when we look at the times and what Black people were allowed and able to do, the tobacco industry was way ahead of its time in hiring Black folks, putting them in management positions, and kind of digging their way into the Black community in the sense of being someone that supports the Black community and provides for the Black community, which is important as we get to today's times and the relationship between African Americans and the tobacco industry. So again, so at the time, it was an untapped market. So yes, African Americans were working in the tobacco factories, but they weren't necessarily being looked at as a customer base. This is an example of what advertising looked like early on. So as an African American, you would look at this and, hey, this is pretty offensive. So Big Tobacco realized, hey, this is a whole market that we haven't tapped into yet. We may need to change our tactics here. And this is where you start seeing targeted marketing aimed at African Americans, where the African Americans portrayed are successful, they are athletes, they're musicians, and they are peddling this product to African Americans. And it's not only African Americans that are targeted. The LGBT community is also targeted. Here's an example of a Parliament ad from the 90s, where the image to the left is in I guess you would call it a quote unquote mainstream magazine. The image on the right is the same advertisement in a LGBT focused magazine, where you can see they've added another gentleman to the picture. Again, with targeted marketing towards the LGBT population, they use you can see it in the corner, the little rainbow, the choose I choose. So there's a sense of empowerment, grasping onto the LGBT rainbow and kind of showing their support for the community. Then another targeted marketing project called Project Scum, which kind of gives you an idea of how the tobacco industry really thinks of their customers. This was a project that focused on the subculture in San Francisco. So homeless folks, people living on Skid Row. You know, the tobacco industry doesn't care who you are as long as you buy their product. So bringing it back to African Americans, as a result of targeted marketing, we see that from the early 50s, where there was about a 5% rate of African American smokers using mentholated products. Once the tobacco industry realized that, hey, African Americans have a slight preference for menthol, you know, let's roll with that. And as a result, now African American smokers smoke menthol cigarettes at a rate of closer to 90%, which is the highest rate for any population and mentholated cigarettes. So what is menthol? So let's just talk about what menthol is for a minute. And just really quickly, I'm going to ask a question if folks can just type some stuff into the chat box or the question and answer box. When you think of menthol, besides cigarettes, what products, consumer products, come to mind? So I'm seeing gum, cough drops, mint, mojitos. But exactly. Vicks Vapor Rub shampoo. And those are exactly the examples I was thinking of. So menthol is an organic compound found in peppermint and other natural oils. But it's also found in so many other consumer products: gum, cough drops, shampoo, Vicks Vapor Rub, things that are kind of healthy, or you're going to find them in the health aisle at the drugstore or at the supermarket. And it goes way back. I've got a whole presentation on the creation of menthol cigarettes. But just briefly, menthol cigarettes were created as a result of an asthmatic storing his cigarettes and his little menthol stones, these little crystals, these little menthol crystals that he would inhale the menthol vapors to clear up his sinuses. He kept them both in the same tin and discovered that his cigarettes had absorbed some of that menthol, and that's how menthol cigarettes were created. But why is it a threat? So again, 90% of African Americans smoke menthol cigarettes. African American smokers smoke menthol cigarettes. The prevalence of menthol cigarette use among African Americans, young African Americans, is about 72%, and it just increases with age. So that's where we see, 90% of African American smokers using Cools, menthols, compared to only 30% of white folks that use menthol cigarette, that smoke cigarettes. So when we look at the other priority populations that have been disproportionately targeted, we see, again, some of the same populations that the CDC is currently funding: Asian Americans, Latinos, the LGBTQ population. And if you actually break down some of these populations, Asians, Latinos, some of these subpopulations actually smoke at rates closer to African Americans. For example, in the Latino population, if you look at Puerto Rican smokers, they smoke at a much higher rate than that 40. Oops. Sorry about that. Having a little technical difficulties here. So if we look at Latinos, 47%. Puerto Ricans actually smoke menthols at a rate closer to the 85, 88%, similar to African Americans. Now, when we look at youth specifically, African American youth, 95%, Asian youth, 61%, Hispanic youth, 58%, whites, 51%. those menthol rates are for teen smokers. And what we do know is that most smokers start with a flavored product or a mentholated product because it's easier to initiate with some kind of flavor as opposed to just going with a regular cigarette. And of course, flavors are aimed at youth. And what a lot of folks don't realize is that most tobacco products have menthol in them. So way more than 90% of cigarettes marketed here in the US contain menthol, even if it's not advertised as a menthol cigarette. So if it contains a certain level of menthol to where it's a characterizing flavor, that's where you have the Newports, the Cools. But pretty much every cigarette or tobacco product on the market has some level of menthol. Without the menthol, the tobacco would be just too harsh to ingest. So keep that in mind when we talk a little bit later on about the banning of menthol completely, a comprehensive ban of menthol. So going back to how menthol has affected African-American smokers, as a result of the menthol and the different ways the tobacco industry has manipulated the nicotine versus the menthol, tobacco use has claimed the lives of almost 50,000 African Americans every year. It's linked to 63% of cancer deaths among African American men, which is the highest cancer mortality rate for any group. An interesting fact here is that African Americans tend to smoke fewer cigarettes a day, and they begin smoking later in life. But at the end of the day, smoking-related diseases and mortality are significantly higher in the African American population. When we look at African American teen smokers, they have a greater risk of developing long-term consequences. And again, African Americans are more likely to die from cancer than any other ethnic group. A lot of that having to do with tobacco use. And we also know that menthol makes it harder to quit. It actually makes it easier to start and harder to quit. So young people are more likely to remain with their starter type of cigarette over time. So if you start smoking a menthol cigarette, you're probably going to maintain that same type of cigarette over the length of time that you remain a smoker. And then there's a lack of knowledge among consumers to exactly what menthol is and how it affects your smoking habits. When we look at smoking-related causes of death among African Americans, all of the diseases and conditions in red can be related right back to smoking. So if we add all that up, it's close to 70% of the leading causes of death among African Americans can be related to tobacco use and smoking. And it's not just cigarettes. So, here we are in 2019, if you mention cigarettes to youth, to teenagers, 9 times out of 10, they're going to look at you crazy like, oh my gosh, we don't smoke. That's disgusting. That's terrible. We've seen the ads. We've been taught this for years and years that smoking is bad for you. But now you've got your e-cigarettes, you've got your Juuls, you've got your hookah. So there's a changing landscape of tobacco use that is almost completely just ignored the fact that these are tobacco products. So the youth think of tobacco products, they think of cigarettes. A lot of times they don't connect it to Juul, to hookah, to cigarillos and cigars, the Black and Milds that come in, all kinds of different flavors, the Swisher Sweets, Tropical Fusion, strawberry, grape. It sounds like the Kool-Aid selection at the grocery store. So again, we're seeing the tobacco industry kind of focusing on that younger crowd, the younger audience, because what happens to their older customers? They're dying because of the product, so they have to continually recruit new smokers. So before we start talking about the social injustice and the inequality, this quote from Martin Luther King: "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." And I would just add that the disparities as a result of tobacco use are just as shocking and inhumane. So, social injustice of menthol, how is it not fair? Let's talk about that. So again, we mentioned the predatory marketing to vulnerable populations. So low income, low education, minority populations. Those are the focused, targeted populations that the tobacco industry has set out to get addicted to their product. You'll find in communities where there's more African Americans, where there's more lower income, lower socioeconomic status, there's going to be more advertisements at those stores. There's going to be more discounts in those communities, so you can get the product for cheaper in those communities. You're going to see cigarette sampling vans. Well, maybe not anymore, but 20, 30 years ago, they would drive through these communities and literally give out the product, which is very similar to, if you were a kid in the 80s and the Just Say No campaign, that was always the method that the drug dealer used. You give them a sample and get them addicted. Same thing big tobacco is doing and continues to do. Although cigarette sampling bans are outlawed, from personal experience, just 5 or 6 years ago here in Durham, North Carolina, I witnessed it wasn't a cigarette van, but it was a tobacco industry van, and they were giving away free cigarillos and the blunt wrappers. So although there was no tobacco in the wrappers, the wrapper itself is a tobacco leaf, but they were literally handing these out in one of the low-income community housing projects here in Durham. And this was just 5 or 6 years ago. Another way that big tobacco digs their claws in is to donate to African-American elected officials and different African-American organizations, sponsoring community events like the Cool Jazz Festival, which continues to happen every year, sponsored by Cool Cigarettes. Now, 10 years ago, the Family Smoking and Tobacco Control Act was passed, which restricted the sales to youth and sales on flavored cigarettes and to youth, increased the warning labels and disclosure of the ingredients. And the whole purpose of this was to reduce the initiation of youth smoking cigarettes. Because again, most youth start with a flavored product. However, one flavor was exempted, and that was menthol. So now we have a nationwide act that is aimed at protecting the youth, increasing the health of Americans. However, it left out a whole segment of smokers, which leads you to ask, well, why were these specific smokers not included in this attempt to decrease, smoking and the disparities that come along with it? So you've got, 30% of the tobacco cigarette industry, 30% of their sales come from menthol. So we know that, money is the one of the issues here. But also when we look at who smokes menthols, again, we're seeing that it's not the majority of the population. It is these subpopulations that are most affected by menthol, and these subpopulations that were basically ignored in this Family Smoking and Tobacco Control Act. Again, when we look at menthol and how it affects communities, for each 10% increase in proportion of African American students, the discounts in those communities are 1.5 times greater. Advertising is increased. The promotions or the sales are higher, and the cost of Newports is lower. So we're in these already vulnerable communities with this product, and we're just making it easier for people to get a hold of the product. And when we look at a lot of these corner stores in low-income communities and African-American communities, Latino communities, you can actually go into a store and buy one Signal cigarette. So, you know, I don't have $7 or $8 to buy a pack of cigarettes. Oh, no problem. Give me 75 cents, $1, and I'll give you one cigarette to, you know, keep your addiction going. And if you go into, let's say, a Sheetz or a BP gas station and ask for a Lucy, they'll probably look at you like you're crazy. Go into any corner store in the hood, ask for a Lucy, they're not going to ask you what kind, they're going to give you a Newport. So again, you know, these low-income communities, these vulnerable communities are more apt to be able to get a hold of the product that's, you know, killing us. And that's Big Tobacco's, that's their tactic, is to get into these communities and, you know, addict people, get them, you know, on their product however possible, come off as being supportive and part of the community. So an example is Big Tobacco donating to these major African-American organizations: Urban League, NAACP, United Negro College Fund, Congressional Black Caucus. And if you look at the other networks I mentioned earlier, you'll see the same thing. Big Tobacco is contributing to these communities as well in order to gain that support from the community. Lorillard Tobacco, who produces Newports, has actually given more than half of Congress's Black Democrats funding back in 2014. So I'm not sure how many Black Democrats there were, but half of them received money from Big Tobacco, whereas only 1 in 38 non-Black Democrats received money from Big Tobacco. So as you can see, you know, Big Tobacco they know what they're doing when it comes to getting support. Now, one of the other ways that they dig their claws into the community is by having these nationwide town hall meetings, where the title of it was decriminalizing the Black community. Okay, if I live in a Black community that's got a high crime rate, this is going to interest me. I want to go to this meeting. However, once they got there, the topic was actually the banning of menthol. That was the discussion. So it wasn't really about your community. It was about trying to find support for, you know, going against a ban on menthol. So they brought in Al Sharpton, and he talked about how if menthol is banned, then that just gives police another reason to interact with young Black males. You know, that gives them another reason to involve them in the criminal justice system for having a cigarette, which is not true, because any tobacco bans or restrictions on sales, the onus is on the store owner, the store operator. So the law is not for possession of a menthol cigarette, it's for the sale of a menthol cigarette. But again, Big Tobacco trying to get in front of that wants to change the narrative. So it's important to realize what the real narrative is versus the narrative that the tobacco industry wants people to think. So when we look at, well, what can we do? What kind of system, policy, or environmental changes work? We know that banning menthol works, tax increases, no smoking in multi-unit housing, having smoke-free workplaces, and having culturally tailored media campaigns are all things that we can get behind and support in our efforts to just make the playing field a little more equal when it comes to the health disparities that are resulting from tobacco use and exposure to secondhand tobacco smoke. So some examples, banning menthol. This slide is kind of old, so it says Chicago, but since then, there have been dozens of places that have banned the sale of menthol and flavored tobacco. So tax increases, multi-unit housing, the HUD rule went into effect last year, which bans the use of lit tobacco products and e-cigarettes on HUD properties. Smoke-free workplaces, most places are smoke-free, most workplaces are smoke-free. However, if you look at the places that aren't smoke-free, you'll see that the majority of those employees are going to be from these priority populations. They're going to be people of color. They're going to be people that don't earn a whole lot. They're going to be people that don't have health insurance. So although smoke-free workplaces is awesome, when we look at who is not covered by smoke-free workplaces, again, it's going to be those specific segments of the community that we have been talking about. Culturally tailored media campaigns. So an example is Pathways to Freedom. So there's tons of smoking cessation options out there and programs. However, what we need to realize is that it's not one size fits all when it comes to smoking cessation, especially with menthol cigarettes. When you look at menthol cigarettes, the quit rates and the successful quitting of menthol is much harder when compared to folks that are smoking non-mentholated cigarettes. And this is just an example of another culturally appropriate media message called Fresh Empire, where they take, youth that, are in popular in pop culture and use them in the ads to promote cessation, promote, not smoking at all or starting to smoke at all. And then the CDC Tips campaign gives some real life examples of long-term smoking and how it can affect you. For NAATPN, some of the things that we use, one of them is the Pathways to Freedom, which is a manual and a DVD. The DVD is the updated version. And it was authored by African-American scientists and community leaders, and it really focuses on the African-American community and how the nuances of being African-American, it addresses that as it relates to smoking. The DVD was created in 2013, so it's a revised and updated version of the booklet that's available on our website. No Menthol Sunday is an event that we promote across the country. Again, this slide is old, so we've had 2 since then. No Menthol Sunday is a date that we set aside and we provide churches, community organizations with information and speakers, if necessary, to talk about menthol and flavored products in their community and what they can do in their communities to kind of get ahead of that. And this year we put a strong focus on jewels and e-cigarettes, as that seems to be where big tobacco is headed in that direction. Health Equity in Practice is a training guide that we are finishing up that we will be presenting to state and local tobacco control agencies, if they're looking to work with African Americans in tobacco control, this Health Equity and Practice Guide is a one-day training that we provide to kind of introduce folks on how they can better work within the African American community when it comes to tobacco control. And these are just options that if folks are working with African American communities and need some assistance, feel free to reach out to us or the other networks. I'm sure Jackie said she's going to send my contact information along with the slides. So please feel free to reach out if you have any questions or want some technical assistance as far as working with specific populations. So we continue to support menthol restrictions and a comprehensive ban on menthol. So right now the FDA is actually thinking about banning menthol completely, with the caveat that they'll keep it in e-cigarettes. So what we want to do is support a comprehensive ban. Just ban menthol completely. We know that with a large number of menthol smokers, if menthol was banned, they would quit smoking. They just wouldn't smoke anymore. Some people would switch, but we know that some people would just outright quit smoking, which is a good thing. So we want the menthol to be banned, and flavors. So to close, I want to give a quote from Dr. Phil Gardner, who's a titan in the tobacco control arena. The disproportionate marketing and targeting of menthol-flavored poison to African Americans and other especially marginalized sectors of our society is outright discriminatory and genocidal. The poorest, least informed, those with the fewest resources. Indeed, this is the definition of preying on the most vulnerable sections of our society, which is exactly what Big Tobacco has been doing for the last 100 or so years. And Dr. Phil is one of our major partners. We work constantly with Dr. Phil and his organization. And he and his organization do a lot of work across the country. Their organization is the AATCLC. Again, AATCLC. And they're also available to do trainings and presentations. If you've never seen Dr. Phil in action, I'm sure you could probably look up some of his stuff on YouTube. Again, he's a titan in the industry. So now I was kind of looking at the question and answer. Looks like a couple of questions came up, but I do want to give folks the chance to ask for questions, clarification. So Jackie, I will let you control the screen now, and if folks have questions, I think we've got, what, 15 minutes left? I would love to answer some questions.
Okay, great. Let me see what's in the chat box. Okay. Okay, so we have a couple of questions just on the PowerPoint. And yes, this PowerPoint will be available to you. I'll send a follow-up email to everyone after the webinar with the PowerPoint and recording and Michael's contact information. So you all will have that available. I got a question that says, how do we secure the DVD?
You can contact us via the website, and we can either send you a hard copy, or on the website, once you put in your contact information, you will be sent a link to the video on YouTube. So you can either get a link to the video, or we can send you a hard copy.
Okay. So question, do you have prevalence data on ENDS use in African American youth? Or know anything?
Right now, we do not. So we do not have any prevalence data on electronic nicotine delivery devices for African American youth. But what we do know is that compared to white youth, African American youth are not using them at the same levels. However, again, Big Tobacco realized this, and now we're starting to see more advertising, more marketing in African American markets for these jewels and other e-cigarette devices. One of the caveats is that, you know, for these e-devices, there's a startup cost, which is, you know, a lot more than buying a pack of cigarettes. So what we're starting to see is, again, you know, discounts for the startup package. I was traveling a couple weeks ago. I was in Houston, Texas, and there was it wasn't a jewel, but it was a very similar device to the jewel being advertised in this. It was a gas station, but it was in a, you know, a not so good neighborhood, for 99 cents. So you buy that for 99 cents, and now all you have to do is buy the pods, and there you have it. So again, Big Tobacco knows that, all right, well, we got to get the price point to where, you know, folks can afford it, and we need to advertise in these specific communities. But unfortunately, we don't have any. I don't have any prevalence data on African American youth and its use yet.
Okay, great. Let's see what else has come in. Okay, got a question. Is there more you can tell us today about how to engage these communities? So African Americans or other communities, what would you recommend to engage these communities a little bit?
Well, first of all, I think that there has to be, it doesn't even have to be a person of, you know, like if you're working in an African American community, ideally, I think you would want an African American person or a Latino person to be able to really speak to that community. But there are plenty of allies that you know, are comfortable and knowledgeable to go into these communities. So I think that the first thing there has to be trust, a trusting relationship between, you know, the organization and the community. So that's the first place I would start. And for the organizations that are going into the community, they need to have the background knowledge, especially if they're not from that community, which is why the CDC funded these 8 organizations. So if you're looking to work in these communities, you can reach out to one of the national networks, and they can provide TA, they can provide some assistance, some culturally relevant materials. So that's where I would start, is just being culturally aware of how to approach those specific communities. Oh, I see a question about other cities and jurisdictions that are currently considering putting menthol bans in place. New York, New Jersey, right now in California, we have strong support. Oakland, San Francisco, Beverly Hills have already banned menthol and flavors. Minnesota, St. Paul and Minneapolis have done the same thing. So, like I said, right now, there's a lot going on with menthol bans and restrictions. So if your area, you know, if there's no preemption, and the talk comes up, you know, support it, you know, inform your legislators, people that are making the decisions. That's another important thing, is to get behind the folks downtown that are making the decisions, because a lot of them aren't aware of the facts surrounding menthol, the facts around e-cigarettes and jewels, and they're the ones that are going to be signing off on these bills, on these laws. So they need to be informed. So if you can go to the Capitol and get on the list and speak for a few minutes to inform these people what is happening regarding, you know, jewels and menthol flavored cigarettes.
Great. Great. Let's see what else has come in. Can you speak to any unintended consequences that have been observed from menthol bans? If so, what recommendations do you have that can mitigate those consequences prior to implementation?
Oh, that's a good question. So going back to the Reverend Al situation, what he was promoting was that these menthol bans were going to somehow increase, you know, African American men specifically being approached and having interactions with the police. We haven't seen any of that in in these jurisdictions where the menthol bans have passed. So that's one. Another unintended consequence that the opposition has been promoting is that there's going to, become an underground market for menthol cigarettes. We haven't seen that either, because most of the time with these jurisdictions, the next town over probably doesn't have that same law. So if you need a pack of Newports, you can just drive over to the next town. So we haven't seen any negative unintended consequences yet, and hopefully there won't be any. But to mitigate any consequences, what I would say is to be, in speaking of these bans and restrictions, letting folks know, letting the community know, letting the decision makers know that it's not on the public, it's on the retailer. The retailer is the one who has to, make sure that they're following the letter of the law. So if they're caught selling a menthol product, their license could be suspended, they could be fined. But as far as anything negative, community-wise, we haven't seen anything yet, and hopefully it remains that way.
We have some people that shouted out their states. So we have a comment that says, "Don't forget about Massachusetts." So yes, Massachusetts is one of those. And then we have another comment: Albany County, New York, is currently considering a comprehensive sales restriction that includes menthol flavored products.
Awesome.
Okay, if anyone has any more questions, you can drop them in the chat box. We have a few more minutes if anyone has any further questions.
And just real quickly before we end, just for folks that are working in communities and they think that, cigarette use is not a problem in our community. It may not be, but e-cigarette use, when we look at youth, e-cigarette use is a problem everywhere in this country. And again, menthol is a component of a lot of these tobacco products, and Big Tobacco does not want to ban menthol. So, the word on the street, the word that Big Tobacco is putting out is, we want to see people quit smoking, which, if you know anything about Big Tobacco, what they say needs to be taken with a grain of salt. Yeah, they don't want to see people smoking anymore because they realize that the way to go now is with the e-products, and keeping menthol in the e-products is a way of, making the transition from combustible cigarettes to e-cigarettes a little more palatable. So they definitely want to keep menthol in there for a reason. So hearing Big Tobacco say that they want to be out of the smoking business it's all smoke and mirrors, no pun intended. So I know the majority of this presentation was on combustible cigarettes, but Juul is the what's exploding right now, and what's probably going to be, well, not even probably, it's the next epidemic. I think that the smoking epidemic is on the decline, but now we have the increase of Juul usage and e-cigarette usage for a whole generation of people that look at smoking as disgusting, would never pick up a cigarette, but yet they are using the Juuls or other e-products 9 times out of 10 that are flavored with some kind of fruit, chocolate, something attractive to youth and kids.
Mm-hmm. Looks like there are some questions that came through the Q&A box. If you can see those, Michael.
Okay, yeah.
2 or 3, the Q&A box.
Oh, here's a good one. Have you started to notice the same tactics by big marijuana with CBD and marijuana? Yeah, we are seeing some of the same tactics, especially with CBD, because it's not really, CBD is touchy, but you do see a lot of these advertisements for CBD everywhere now, and with marijuana. And if you dig deeper into big marijuana, you're going to find some connection with big tobacco. Again, big tobacco is pushing no smoking, no combustible cigarettes, but they're promoting e-cigarettes, and they're definitely involved in the marijuana industry as well. There's a question about engaging local retailers. Now, for the addressing retailers, I think that Counter Tools may be able to answer that question more so than I can. We don't necessarily do a lot of point of sale interventions directly with stores, where I know that Counter Tools does a little bit more of that. So they may be able to answer that question. One more question here. Oh, that was just a comment. Thank you, Marilyn, and we'd be glad to assist in any way possible. Yes, especially in South Carolina. Yep. South Carolina, I'm not sure if folks are aware of Tobacco Nation, which is a swath of states kind of in the Midwest where tobacco use rates are completely sky high when compared to the rest of the United States. South Carolina was just added to that list of Tobacco Nation states. And we're right here in North Carolina. So definitely reach out to us and let's see what we can get going down in South Carolina.
Great. I think that's it. Well, thank you so much, Michael, for this informative webinar and presentation. I hope those on the line took away some helpful information and some information that you can use in your own efforts. Like Michael mentioned, you can reach out to him and I'll provide his contact information in the follow-up email, or you can reach out to the other networks if you have questions or need assistance on specific other populations. And yeah, thank you so much again, Michael, and I hope everyone has a good rest of their day, and just look out for a follow-up email from me.
Thank you.